Hi, this is Jessica DeMassa in the Guidewell Insights Lounge. I'm here at Exponential Medicine, and I'm joined right now in our lounge by Zayna Khayat. Zayna is the Senior Advisor for Health System Innovation at Mars Discovery District, which is in Toronto, Canada. So Zayna, welcome.
Thank you.
Good
Great
to have
be
you here. So we were talking a little bit earlier about this concept that you're speaking on, and you were talking about exponential entrepreneurship. So tell me, what does that mean?
Yeah, so if entrepreneurship wasn't already hard enough on a good day, we've added this extra word of exponential, and I would link it to, this concept of a 10x lift of value, of performance or something. If you're going to get that kind of a lift, if you think about it in a normal sense, a 10 or 20% increase of something being better is already really hard to achieve, particularly in health. When you're going 10x, that's exponential. You're not going to get there with an exponential. And so the entrepreneur, who's a status quo buster, and is again really hard to bust any status quo, but to take a 10x lift is the exponential entrepreneur, and it's a bit of a different breed.
Okay, so tell me a little bit about that breed. What kind of characteristics do they have?
So it's this kind of, for sure, there's that vision of seeing that end goal of what kind of value is there, and especially a good clue would be if everyone else thinks you're absolutely crazy, right? So we could think of like an Elon Musk, or frankly, I would say a good chunk of the types of people presenting here at xMed. It might seem so way out there, which is exactly that nugget, that starting point. And then the ability to actually kind of step through all the steps to get to, and we use the word scale, but this is beyond scale, because you first need to undo the old, bring in the new way of seeing the world, and then scale that, right? It's a different set of skill sets. And so those are just a couple of them that are extra bonuses you need to be an exponential entrepreneur.
So can anyone become an exponential entrepreneur, or is this something that is just born into you?
I think the whole nurture nature probably fits with everything. I think what we're seeing from some of these really well-known clusters of innovation is there's a lot of nurture. Because the more you're exposed to people who think that big, then the possibility opens in your brain, right? There's the odd savant or whatever who just, but you can't expect we're going to solve the toughest problems in the world on a chance that, the Messiah is, born in, I don't know, some town. So I think we're breeding them through things like singularity and a bit of what we're doing at Mars, so that you take away any of the learning cycles, short circuit all that, right? So that they can kind of rise as quick as possible and get the tough jobs done.
So is there a way to better nurture an exponential entrepreneur, especially in some of our larger health companies, as they're trying to develop innovation teams or build in to accommodate some of these exponential entrepreneurs coming in from outside? How do we nurture them?
So awesome question. So I think the way we think about how do you achieve the true innovation is it's invention plus adoption equals innovation, right? You can't have innovation until something's happened that created value. The nurturing on the invention side, because often the Trojan horse to get the big impact is the tech in this world, because it's exponential, I think is pretty good. Things like singularity, other accelerators, we do that at Mars, finding some edge of science and getting it to kind of something that can impact patients. Where there's been less effort, I'd say, and now you're starting to see it more, is on the nurturing exponential entrepreneurship on the adoption side. Which is, all the vessels or vehicles to distribution, to getting the patients, to doctors, to regulators that you need. And that's incumbents, that's legacy organizations. They need to be exponentially entrepreneurial, and that is a tall order, because they're generally not even innovative on a good day, right? Now we're asking them to kind of blow up their own business model in a very serial. So I'm seeing a lot more effort on building what we call intrapreneurship, because it's in an organization on the demand side of health innovation. I think when we get that a little bit more mature, it's all just going to go.
How do we accelerate the pace of these larger organizations being able to step into that role of being able to accommodate exponential entrepreneurship?
So there's a lot of different ways to do it. A couple examples I'll call out. One is the role of this intermediary, whether it's like a Singularity or a Mars, that's not any of the current players, therefore it can be everybody, but understands the issues of the innovators, the academics, the patients, and they can help, say, the regulator or the government body facilitate the process to make a big change. I'll give you an example. We've been talking, in this meeting on the FDA, really rethinking its model to regulate digital devices, because it's got to be so rapid, because the rate at which they're coming, you can never regulate fast enough. Completely different way for an institution to work.
Right.
That's because there's a broker in between that's helping them with that process.
Okay.
So that's one. And the other is just build capacity for entrepreneurship.
Okay. How do you do that?
Just teach it. So much like in the world I come from of healthcare, there was a renaissance in performance when a new capacity we stole from the Japanese in the auto industry called Lean, Six Sigma, quality improvement. All of a sudden, pretty much any health org now has a chief quality improvement person.
Right.
They hired Six Sigmas. QI is just like the back of their hand. The next generation is innovation being like the back of their hand.
Excellent.
Dedicated people with a very clear toolkit, process, funding. It's in their performance management. It's how you hire. That new capability is coming, and then there's brokers, and there's many, who actually literally are in there teaching innovation.
Wonderful. Well, Zayna, thank you so much for joining us here in the Insights Lounge. We love hearing about new ways to bring exponential entrepreneurship into our organizations, large and small. It's been a pleasure speaking with you. I'm Jessica DeMassa at Singularity University's Exponential Medicine from the Guidewell Insights Lounge.